So we have a 25-year-old male weighing 165 pounds and is 5'8". He has a history of post-up cabbage and smoked 1 pack per day for 10 years. He has no history of lung disease. We did the weaning trial and he passed everything with a vital capacity of 2.1, NIF of 30, and PIP of 20. I'm going to wash my hands, put on gloves, go into the room. Hello, Mr. Smith. How are you doing today? My name is Geraldine. I am with Respiratory. Do you mind sending your name and date of birth for me? Alright, so we're here to extubate you today, okay? First, I'm going to take some of your vitals. So I'm going to listen to breath sounds, heart rate, everything. Current vitals are temperature of 98.7, SATs of 95, heart rate of 80, blood pressure is 110/65, respiratory rate is 10, and breath sounds are clear. He is on the PV980 vent. He is on a tidal volume of 450, rate of 8, PEEP of 5, and an FiO2 of 40. An indication of extubation is when the patient is capable of maintaining a patent airway and generating adequate spontaneous ventilation. So after we extubate you, we're going to be placing you on a nasal cannula of 5 liters. And we just need to make sure that we have all our equipment ready and gathered. What we need mostly is our suction setup, suction canister with a yanker, an ambu bag, and syringes to deflate the cuff, and oxygen source and delivery device. I have the cuff right here. Alright, so I will be hyperoxygenating. First, I'm going to suction the mouth, around the mouth. Okay. And I'm going to suction you 1 time before we extubate you, okay? This is going to make you cough. Alright. Now we have suction you. And we're going to hyperoxygenate you. 100%. And now I have everything ready. Here's the suction. I'm going to deflate the cuff. Or disconnect the tube first, the tubing. Now I will deflate the cuff. And we need to check for a cuff leak test to detect potential glottic edema. And he got greater than 15%. So now I will deflate the cuff. Cough for me if you can, as hard as you can. Cough, cough, cough. Alright, we got that out. We're going to suction. Put the ventilator on standby. Suction, suction. And right now we'll be placing you on a simple mask, but we're going to change this out to a nasal cannula, okay? How are you feeling? Good. Alright. We're going to throw all the ETT stuff away. We're going to take your vitals 1 more time. Listen to breath sounds. Alright, you still sound pretty clear. That's good, okay? Some complications could have been laryngeal edema or pulmonary edema, but this went well. We're just going to be checking up on the patient. We're also going to get a blood gas later on to see if anything has changed. And that's it. Just let me know if you need anything. You have your call bell here, and we'll be right back to check on you, okay?